If it's a rigid 5-page plan of I will not accept Pitocin, no epidural, like sometimes you need some of those tools in the toolbox to be able to have your baby and avoid, say, a surgical birth that would take longer for recovery.
Do birth doulas statistically lower the rate of surgical births?
Yes, and that is because the continuity of care, that continuous support, they have that relationship all through pregnancy. The clients trust their doula, and the nurse, as wonderful as the nurse may be, they're working with other patients, they're charting, they have so much focus on the health of mother and baby that they can't be the emotional support for the partner or the way a doula can. And we also support physically, and a lot of hip squeezes, counter pressure, labor massage, and we know different positions to try. Say if labor stalls and the OB walks in and says, nothing's really happened in a couple hours, let's talk about some next steps. Then we can talk through the risks and benefits and alternatives if it's not an emergency to any intervention. And then the client can come up with a plan. And it might be, let's try a couple positions and then see if there's any progress. Or maybe it is better to try Pitocin if the contractions are spaced out too far from each other.